Hi, my name is Aayushi. I'm a D1 and I did my research on the impact of orthodontic treatment on temporomandibular disorders and their manifestations as a literature review. I worked on this project with Megan Nacarado, Hannah Chris, and Dr. Manhunt. The association between orthodontic treatment and TMD remains a source of clinical debate. Earlier studies found no definitive cause between the two, but many did not distinguish between treatment modalities or account for important patient factors such as sex, age, malocclusion type, and baseline pain levels. A more focused study was needed to account for those different clarifications and to clarify those complex interactions as well. I was interested in this project because I'm interested in pursuing orthodontics as a specialty, and I've gone through orthodontic surgery myself, which can often lead to those TMD issues. So I was hoping this research would help me explore that relationship further. The main objective was to systematically evaluate the relationship between various orthodontic treatment modalities, such as fixed appliances, clear aligners, functional appliances, and changes in TMD symptoms to identify patient and treatment-related factors influencing these outcomes. The methods were done through a database search terms where we looked up orthodont, temporomandibular joint disorders, and then complications, limitations, failures, or challenges. And the databases we looked through were PubMed, Scopus, Web of Science, Dentistry and Oral Health Source, and then Embase. The inclusion criteria for our articles were articles that were written in English, human research subjects, peer-reviewed, full text available, and they had to be related to TMD complications in orthodontic treatment. And then articles that were excluded were not written in English, they weren't peer-reviewed, they were done in animal-based studies, they were review articles, editorial or opinion-based articles, conference proceedings or abstracts only, and then they had no full text available. After these inclusion-exclusion criteria, we did a synthesis of findings to perform and identify common themes. We started off with 675 records and reviews found in our search base and ended up with 26 after removing duplications or articles that weren't relevant or weren't peer-reviewed, and those articles that were excluded based on our exclusion criteria. From the 675 articles, 470 qualified for review and 26 were included, comprising of 6 cross-sectional, 4 case study, 8 retrospective, 7 prospective, and 1 longitudinal and cross-sectional study. Within those 26 articles, I took a look at what appliance was studied. Some of them didn't have any to report. Some of them had a mix of a few appliances, but fixed appliances was the most common treatment type in these studies. And in our results, we found that orthodontic treatment overall was not associated with an increase of incidence of TMD. Differences amongst those treatment modalities were observed, with fixed and functional appliances demonstrating a modest and transient increase in TMD related symptoms. And then symptom exacerbation was most commonly reported in patients with pre-existing TMD. In the future, we're hoping to have standardized prospective studies that are evaluating TMD outcomes using a uniform diagnostic criteria, and then further stratification by sex, baseline pain, and psychological factors that might help identify high-risk patients. To conclude, really, we found that orthodontic therapy does not appear to cause TMD, but many symptoms and patterns are susceptible in those individuals. Recognizing patient-specific factors and treatment characteristics can enhance decision-making and support personalized, risk-informed orthodontic care overall. And I just want to end by saying thank you to CORE, especially Sydney and Christy, Dr. Man Hung for all of the hard work that she's done to help me plan and do this research, and then Megan Nakarado and Hannah Chris, who helped me with my studies and looking through all the articles. Thank you.